So let's transition to our first panel. I have the distinct honor of introducing very briefly, because full bios are actually in the agenda and in the packet. So let me just do a very quick introduction of each speaker. Each speaker will have between 7 and 8 minutes. I may have a question or two afterwards to just prime the discussion, and then we really do want to encourage your participation. So let me just quickly give a brief introduction of each speaker. To my left is Tim Petty. Tim is the Assistant Secretary for Water and Science at Interior, where he oversees water and science policy and has responsibility for the Bureau of Reclamation and the U.S. Geological Survey. Also, I must say that Tim and I share the fact that we're both alumni of the University of Alaska Fairbanks. That is a blatant pitch. Yes, thank you very much. I just wanted to own that.
That's right.
A little bit. Okay, good. Okay. Jonathan Richard is Deputy Vice President of MCC for Infrastructure, Environment, and the Private Sector, apparently not an alumni of the University of Alaska. Serena Vinter is the Acting Deputy Director for Strategy, Policy, and Communications at the CDC. Jeff Goldberg manages USAID's efforts to align the agency's activities with the requirements set forth in the 2014 Water for the World Act. So please welcome our panelists for the morning. And maybe, Tim, we'll just start with you as well. Is that okay?
I think that'll work well.
Wonderful.
Thanks,
Thank you.
Mike. It's always a privilege to be up here with a fellow alum. I just wanted to just take a few minutes and just kind of have just some opening comments, but looking forward to a lot of interaction and dialogue, good questions, but a great panel up here. I think a lot of the work that takes place is an important aspect of working together, especially in the federal and private sector. So just a couple of my comments. You know, the sound management of water resources is key to the Department of Interior in its mission. Interior is hosted by a diversity of 8 different bureaus, each with their own focus, but water is a resource that connects all of them together. Not only is Interior committed to the sound management of water and other natural resources within the United States, but it also is committed to providing our expertise internationally to both give and take in support of the U.S. foreign policy goals. Our international programs at both Bureau of Reclamation and the U.S. Geological Survey, it's an exchange. And these exchange programs internationally benefit both the counterparts abroad as well as the Department of Interior as a whole. Throughout its history, Interior has been a collaborative international management natural resource, honoring cultural heritage, supply of water and energy, and advancing in scientific research on behalf of the American people. The resources that we manage and protect within natural disasters, we prepare for and respond to each of those per request. And we look forward to being able to give in scientific research as well as we conduct all of these international endeavors. As the Assistant Secretary for Water and Science, I oversee, as Mike said, both the U.S. Geological Survey and the Bureau of Reclamation. I have the experience of firsthand and value at Interior and international engagement. While working at the Interior, even in the past Bush administration, I led several different delegations to areas of Guam in the Pacific, as well as in Vietnam, as well as to Libya, in alternate energy, water, and environmental impacts in those different areas. Globally, the U.S. Department of Interior is committed to working together with the 2 bureaus that I oversee. I want to highlight 2 examples of items that are important to us, but first a framework of how reclamation and GS work together. One is to enhance the efficiency and stability and sustainability of water-related infrastructure. 2, encourage effective and sustainable water reuse, as well as even the administrator at EPA had communicated. And 3, promoting cooperative and shared water resources, because of both Canada and Mexico, we all work together in water interchanges, obviously without borders. Whereas USGS is also a continual implementation of the Global Water Strategy. Its 3 primary goals internationally is to strengthen scientific and technical understanding of international water supply and demand, 2, to help improve global monitoring and management of those water resources, and 3, promoting and providing scientific support. So out of that, I want to give actually 2 quick examples, and both of these examples actually are part of the website that the ambassador also communicated today on the water website. And the first example really highlights some of the things that the U.S. Geological Survey and Reclamation are doing with Brazil and their water resource management. This working collaborative have been going on for multiple years, and we support the State Department as partners with Brazil and the National Water Agency, also referred to as ANA, and it's also Brazilian Geological Survey, CPRM. And we conduct multiple technical and working relationships technically and training-wise between the two of them. And the partners that we utilize comes also from EPA, U.S. Army Corps of Engineers, as well as USDA. All of them working together is how we were able to partner and then partner with these other international groups. In one of the programs under the MOU is Reclamation and USGS working together with multiple areas and even in Africa. So far, this has included one study tour and workshop with Brazil, where Reclamation and USGS experts tour both the San Francisco water conveyance projects, the Brazilian counterparts, and one of Reclamation's lead study tours of the United States, and with ANA here in the United States, where we took them to the Truckee-Carson project in Nevada, as well as the Central California Water Project, the CVP, that so many people here in the United States are very familiar with. These programs will be followed up by workshops in Brazil in 2020, where the observations and ideas spur these studies and tours together in partnership. The second example that I want to just highlight is where USGS has been doing a support groundwater explanation that the ambassador actually talked about earlier in her comments on the assessment in not only drought-stressed regions in Africa, but these strategy priorities encourage the sound management and protection of freshwater resources. With funding provided by USAID, the U.S. Geological Survey and its partners are using geospatial data with remote sensing with traditional hydrological and geological technology and methodologies in areas that are in Kenya and Ethiopia that are a part of the global water strategy. Its primary goals is to locate and quantify groundwater aquifers. This will support both sustainable management and resources for both of these areas. One of the things that I specifically want to highlight is that USGS working in this area of remote sensing gives the coordination of local freshwater agencies the ability for these studies to take effect. In both areas, the success rates before they were able to do for drilling for wells was in the neighborhood of only 30% efficiency, where they were only hitting water 30% of the time. Using these new technologies and new methodologies, the U.S. Geological Survey has been able to develop groundwater potential maps in these study areas that increase the drilling rate of efficiency to almost 90%. And those type of technologies give really great capacity for these countries who are looking, because developing wells and developing resources is an expensive endeavor. The U.S. also has located partners not only in Ethiopia and in Kenya, but the goals is to develop and to train the trainers on how to use these technologies. And we're committed at the USGS to help facilitate those ongoing relationships. This strategy promotes and identifies this safe drinking water supply resource capability that is so important. So in my conclusion, supporting the global water strategy is an important part of Interior, Bureau of Reclamation, as well as U.S. Geological Survey, because a big part of that is having surface capability and storage, which means reservoirs and dams. And Bureau of Reclamation has an international team that works with the State Department and USAID for all the countries in the world to be able to come and interact in how we go through our training for dam development, where Reclamation alone has 492 dams responsible for those reservoir storage surface water. And we have spent decades working on how do we continue to increase dam efficiency. And so many times we hear in the news of dam failures across the world, and even in this country, on how we need to continue to be due diligent and having oversight on those responsibilities. So I look forward to more of your questions as this continues, and along with the great panel that we have here before us.
Thank you, Tim. Jonathan.
Great. Thank you for the opportunity to participate in the event today and speak on this panel. I think first I thought it might be helpful to say a little bit about MCC, who we are, and what our model is, as I think I often find many people aren't familiar with us as they are with many others. MCC is a small agency. We were actually established back in 2004, so we're still fairly new as far as U.S. government agencies go. We have a singular mission. Our mission is poverty reduction through economic growth. And what this means is we target our funds in a way to catalyze economic development and growth to address what we call the binding constraints to growth. So one of the first things we do when we engage a country, when they're selected by our board, is deploy teams of economists to do a constraints analysis and identify what that binding sector is. In this case, what we'll talk about today is water, working in water-scarce countries. The second thing worth flagging here is that we don't work everywhere. So we only work in lower income countries and only in countries that meet our strict eligibility criteria. Those criteria are based on a set of third-party indicators that measure a country's performance on things like economic freedoms, good governance, and investing in people. The third is that we provide grant funding. So it's not loans, it's grants. These are large-scale grants that we call compacts or thresholds. These are packages of projects. The compacts are the larger of the two. They are, on average, about $350 million in a given country, although we've had some as high as $700 million. The thresholds, as the name implies, don't quite meet eligibility for a compact, but they're on the threshold of doing so. Those programs tend to be on the order of about $35 to $50 million. Two other things to point out. One is that our programs are country-led, and what I mean by that is the countries propose solutions, propose projects consistent with the constraints in the sector we've identified. And then the countries work with MCC to develop and implement these projects. And MCC plays an oversight role and I think also a very strong support role to carry these projects out. The last thing is that we have a 5-year timeline to complete these projects. So we're doing a lot of heavy infrastructure, and I'll talk more about that in a moment. But after spending about 2 to 3 years preparing projects, developing them, there's a strict 5-year timeline to carry them out, at which point shovels down, hands it over to the government, and anything that's not done is then on the government to complete. Ideally, we complete everything within those 5 years, but it's not always very easy to carry out such strong infrastructure programs on that kind of a timeline. In terms of our portfolio, big picture-wise, again, since our inception in 2004, we've actually signed 35 compacts in more, I think about 29 countries, totaling about $12 billion. Much of this has gone towards infrastructure and large capital projects in the sectors of energy, water, agriculture, irrigation, roads, ports, schools, et cetera. But it's important to note that we don't just do infrastructure. Infrastructure is a big part of what we do, but we take a holistic approach. We look at the sector and we couple our infrastructure with what we believe are the necessary policy and institutional reforms, technical assistance, and otherwise, with an aim to ensure that the project is sustainable and that it meets high standards, environmental, social, and technical. With respect to our water portfolio, MCC has invested about $2.8 billion since 2004. This has gone into areas of improving water supply and sanitation, water resource management, agriculture productivity, in about 24 countries across Africa, Asia, Europe, Latin America. And overall, our investments in the water sector have included things like urban and rural water supply, water treatment and distribution, wastewater collection and sanitation, wastewater treatment, both municipal and industrial. I think one other piece perhaps to highlight in this regard is that some of our investments are really targeting what we sometimes refer to as the kind of water energy nexus. So looking at ways to use treated wastewater for power plants, plants that might otherwise be drawing fresh water for use in cooling. The water agriculture nexus, so where we're taking wastewater, tertiary treatment, and use it for agricultural production. or water transport nexus, kind of supporting drainage water management. And some of this comes back to, again, our objectives of facilitating economic growth and development, so looking at productive uses of water as well. So since the launch of the Global Water Strategy in November of 2017, MCC's completed 3 projects that I thought would be worth highlighting here today. The first is a $275 million project in Jordan, where we actually installed more than 1,100 kilometers of new pipelines for water and wastewater in the Zarqa area. This is an area just outside of Amman, the capital of Jordan. We also supported an expansion of the Asamra wastewater treatment plant in partnership with a private sector operator who also mobilized a significant portion of the construction costs, and supported training for people on water conservation practices and good water management. The second project is a $355 million project in Zambia. This was completed in November of 2018, so fairly recently. The program in Zambia improved the water supply, sanitation, drainage infrastructure in the capital city of Lusaka. Although here too, again, not just the infrastructure, but some complementary institutional strengthening activities, working with the Lusaka Water and Sewerage Company and Lusaka City Council to improve their asset management, infrastructure management, solid waste management practices in the city. Lastly, just to flag a third program, $41 million project in Cabo Verde. Here we supported reforms in the water and sanitation sector and established an independent utility operating on a commercial basis. We also had infrastructure in this program and expanded some water and sanitation infrastructure on several islands. So perhaps a few more elements just to note regarding MCC's approach. And some of these aspects have been touched on by earlier speakers today. The first is private sector engagement. MCC recognizes that donor funds are not sufficient to meet the grand needs, growth, development needs facing us. So we work across our portfolio to catalyze private sector investment in a way that we call in and around our program. So we want to leverage or blend our limited funds with the funds of others, private sector, donors, et cetera, to achieve a bigger impact. One of the most significant public-private sector participation projects that we've done is, in fact, the Jordan project I mentioned on Asamra, where we expanded a plant initially supported by USAID and brought in a private sector operator for a long-term concession contract. The second piece to flag is that we really have a strong emphasis on results. Evaluations are integral to everything we do. We have a strong commitment to accountability, learning, transparency, and evidence-based decision-making. So we actually have independent evaluations conducted by third-party independent experts for all of the projects upon their completion, and these results are published on our website. In fact, I should say that all of the programs we support can be found on our website as well. Lastly, and this has been a theme, I think, this morning, coordination and collaboration across the U.S. government with other agencies is really important. We work with a range of organizations. MCC is small. We want to play to our strengths and work with others, again, in search of bigger outcomes, stronger impact. We do a lot of work with the U.S. Army Corps of Engineers. They provide a lot of technical assistance, technical support on our programs. We've collaborated with the U.S. EPA, Cabo Verde being a recent example where they helped establish the country's first water and sanitation fund. USAID is a regular player and collaborator. I mentioned the Jordan project a few times. USAID is continuing in that program supporting biosolids and sludge management. And also I heard USGS come up. We've worked a lot with them. Again, a lot of the remote sensing capabilities, looking at water resources. So I think this is an area that we have done a lot of collaboration, but I think looking forward, and this event I think is an example of it, really looking to do more collaboration and coordination with others across the U.S. government. I think that plays to everybody's strengths. Thank you.
Thank you, Jonathan. Serena.
Great. Thank you to the Wilson Center for hosting today's event and for inviting CDC to be part of it. Since everybody's talking about how long they've been around, I guess with the 50th anniversary, CDC has been around for about 70 years. We are very much focused on the public health and keeping people who live in the United States healthy. I think our tagline is protecting Americans 24/7. But I think we have a long history of working on global health issues, whether cholera control efforts in the 1950s, working with partners on global smallpox eradication efforts in the 1970s, and then the global HIV/AIDS epidemic. We also have always been on the front line leading the response to infectious disease outbreaks. So whether novel influenza viruses, coronaviruses like SARS or MERS, and then the more recent Ebola and Zika virus outbreaks. And I think we at CDC recognize that if we want to protect people living in this country from all health threats, as we claim to want to do, we can't do that if we just work in our own borders. And we really have to look at sort of this concept of global health security. I think it complements the concept of water security very nicely. And that we need to work with partner countries so they can build and strengthen their own abilities to detect, prevent, and respond to infectious disease outbreaks. So how do we fit into the global water strategy? I think, as I mentioned, CDC is a science and data-driven agency. We aren't making large grants or cooperative agreements or contracts to do this work. We really rely on our in-house science and technical expertise. So we have these world-class scientists, public health leaders who are implementing disease detection activities, who are training the workforce of the future, who diagnose novel and re-emerging pathogens, both in Atlanta at our state-of-the-art labs, but also building laboratory capacity in other countries so they can diagnose whatever pathogens they're trying to control. We do have the ability to monitor threats 24/7. We have sort of a global disease detection center in Atlanta. They're tracking anywhere from 35 to 45 outbreaks every day, and a lot of these could be related to water. And they might not turn into something like the Ebola outbreak that we're seeing right now in DRC or even the worst one that we saw in 2014 in West Africa, but these are just outbreaks of concern that we pay attention to. We have both forward deployed staff, about 1,700 staff who work in over 50 country offices around the world. We also have about 500 staff at CDC who are credentialed and ready to respond so that if there is a situation where a country or a Ministry of Health or another international partner is looking for support in controlling or responding to an outbreak, we have folks who can do that. So our work in support of the global water strategy is very much done through this public health lens and really falls under the water, sanitation, and hygiene strategic objective. So it's really preventing, detecting, and responding to waterborne and water-related disease, identifying the most effective interventions in diverse settings. And I think we'll maybe talk a little bit more about that, but this could be working on issues in refugee camps or in large urban areas, or maybe working with healthcare facilities in a very rural area where they don't have great access to clean water. We also provide technical assistance and guidance to partners to scale up interventions. So a lot of times CDC will use sort of in-kind technical assistance, maybe some private sector or public-private partnership seed money to do some initial work on a project. And if the results are promising, we can then try to sort of hand that off to a partner, like somebody sitting to my left, who might have deeper pockets to fund the kind of interventions that could be effective at controlling some of the waterborne disease outbreaks or water and related to water issues. We also work on capacity building and technical assistance, which contributes to the governance strategic objective 4 in the strategy. And I think at the end, our goal is really to build global capacity to better prevent and respond to water-related health risks. I think the way CDC supports implementation of the global water strategy, again, is that through that technical assistance and collaboration. And so it's really working with partners on the ground to design, to implement, and evaluate WASH interventions and leverage resources. We are always looking to strengthen capacity through training and then also through global guidance developed with global partners, so whether the World Health Organization, UNICEF, academia. So I think we've had a really interesting opportunity over the past 5 years. I mentioned this concept of global health security, and CDC received a large emergency supplemental in 2015 following the Ebola outbreak in West Africa to really expand our efforts in this area of working with countries to give them the ability to have stronger laboratory systems, have better disease detection capability so that they could do a better job of controlling infectious disease outbreaks in their countries. And I think our representative, Tom Cole, had a great quote that he said at one point. He said, I'd much rather fight Ebola in West Africa and West Dallas. I think that is one of the underlying sort of tenets of this concept of global health security, that we want to make sure countries that we're partnering with do have the capacity to respond to whatever threats they identify. And these could be water-related threats. Cholera is a big concern in a lot of the countries where we work. So with this global health security agenda resources, they're very flexible dollars. And by that, I mean they're not tied to a specific disease. So at CDC, a lot of the funding we receive is very much tied to working on HIV/AIDS or polio eradication. But the global health security dollars are very flexible, and they build this sort of underlying capacity. And so within global health security, the WASH package is aligned with the antimicrobial resistance package. And so we've been able to do a lot of work to look at WASH and really see how that is essential to the concept of infection prevention and control, or IPC, which of course is essential to patient safety and can really control the spread of antimicrobial resistance. If you have people who are not needing to be put on antibiotics because you're able to make sure that they're not contracting diseases in the hospital or the healthcare setting, that's great. So we have been able to do WASH assessments. We have been able to invest in improvements in healthcare facilities in Africa. And I think there's a really great example of some work that we've done in Liberia with this global health security dollars that does get at some of the underlying WASH conditions this country has been facing. And so I think folks well remember that Liberia was one of the 3 countries really at the epicenter of the West Africa Ebola outbreak back in 2014. And so once that outbreak was controlled, and even while it was controlled, we were CDC was there both working to control the outbreak and start to work with the Liberian government to really build up their health system, their public health system. CDC led an initial training on assessing WASH conditions in healthcare facilities. We were then able to continue to provide technical assistance with a local NGO partner and other partners, including the Ministry of Health, and they developed, planned, and implemented comprehensive WASH renovations. And so this included new water sources, new water storage towers, new septic systems, everything from new laundry to mortuary facilities, and also looked at renovating their medical waste disposal facilities. So at the end, the pictures are really amazing, sort of the before and after, and it was really exciting work. And I think, some have argued that maybe this was a special case. It was post-Ebola. There was a lot of attention. CDC was kind of flooding the zone. We were in Liberia with a lot of money. We had the resources to do the work. But I think there are those of us at CDC who really think it's an opportunity. And there's a model for really integrating our WASH work into this broader concept of global health security, especially when we look at it from this lens of infection prevention and control, the quality of care that patients receive, and this concept of controlling antimicrobial resistance. So I think that as we look to the next 5 years of this global health security agenda, and we were pleased with the president's budget that included an increase for this work, we're optimistic that we can continue to integrate WASH into some of these larger initiatives and really make a difference. So I'll stop there and turn it over to you.
Thank you, Jeff.
Great. So I just want to similarly thank the Wilson Center for hosting this event. Been really inspiring to have this opened by Pete Bernicat, our Deputy Administrator Glick, and Administrator Wheeler. Similar to my colleagues, I just wanted to zoom out a little bit and contextualize USAID's work on the global water strategy. So USAID co-leads the overall development and implementation of the global water strategy with our colleagues at the Department of State. And I just really can't understate the collaborative effort that it took with our colleagues in state OES and the entire interagency water working group to produce the global water strategy. So it's really just a huge pleasure to be up here representing the work of many people throughout 2017 to put this together. And I do believe this was the first whole of government strategy that was released in this administration as it pertains to foreign assistance and diplomacy. So we're very, very proud of this work. And it's very exciting to be here. I often talk in the Interagency Water Working Group about USAID's role, and kind of us in particular here in DC, as representing a much larger architecture. So I thought it would be useful just to kind of contextualize that a little bit. So the Water Office that I head up, and then many counterparts in our regional bureaus and our Bureau for Global Health, all serve as kind of an overall knowledge hub and policy advisory role and technical assistance to over 40 missions that are programming water and sanitation foreign assistance. So it really as they say, it does take a village. Bonnie spoke a little bit about USAID being an enabler of all of the great work that we're seeing here in the interagency in many cases. And the team here really is an enabler of all of that work that goes on across our different missions. And that includes our current list of high priority countries and aligned countries too. The agency has a direct appropriation pursuant to the Water for the World Act on water and sanitation that is up to $435 million now, but that doesn't even represent the totality of everything that we are doing on water. My colleague at CDC spoke a little bit to kind of the public health lens through which CDC views water and sanitation, and the agency absolutely similarly looks at safe drinking water, sanitation, and hygiene through that health lens. We also know, though, that water is incredibly cross-cutting, and it's impossible to be able to talk about water without talking about the other development outcomes that it impacts. So from economic growth to women's economic empowerment to education, water just touches so many different parts of the agency. So, our job is to really represent kind of the cutting edge research that's coming out and making sure that our programming in the field reflects all of that. So it's a big task, but we're very happy to be doing it. And so just in terms of where we are in this moment right now, a year plus since the release of the Global Water Strategy, there's obviously a strong foundation and history of water and sanitation programming within the agency that we're standing on. We've reached well over 30 million people with access to drinking water and over 20 million with access to sanitation since we first started receiving appropriations in 2008. But while those numbers are really impressive, they don't tell the whole story. And our Deputy Administrator Glick talked a lot about this new aperture that the agency is looking at all of our programming through, and that's this journey to self-reliance. And we've talked about that a lot throughout the course of foreign assistance, that we need to work ourselves out of a job, but kind of directly inserting that as an organizing principle in terms of how we do all of our programming is something that is really, really being hammered home. And in many ways, I think the Global Water Strategy was quite prescient in the sense that we remain committed to our core accountability of reaching people, vulnerable people with access to drinking water and sanitation, and those results speak to that. But we know that the world is changing, and that to be able to sustain those services and to facilitate the journey to self-reliance, we need to be working on a much larger suite of issues. And so that's where I personally think it's quite exciting that we have this new strategic objective on governance, finance, and institutions. In our agency plan in particular, we're calling out governance and finance and water resources management as critical components to underpin the sustainability of our investments in drinking water and sanitation. So I think just from an overall strategic standpoint, the Global Water Strategy is very much on track with the larger policy agenda that's going on with USAID at the moment. And then, timing couldn't be better, but we have worked on assiduously over the past year on developing new standard indicators to be able to track governance and finance and water resources management. So while we have historically reported on the number of people gaining access to water and sanitation, we now will be very proactively working with our missions to report on improved institutional strengthening, number of dollars mobilized as a result of our foreign assistance, and then the number of people benefiting from improved water resources management as well. So it's an exciting time to really be rounding out this portfolio in response to the changes we see happening. So that's a very high-level framing of just kind of where we are in this moment. But then I just wanted to give some texture to these top-line results. Our Deputy Administrator did a fantastic job talking about a plethora of examples in different countries that we work in, and the contributions that you all in the interagency are making in those countries. But just to kind of go through a few, I think it's always good to kind of drill down. And just to note that we very much agree with Administrator Wheeler's point that we need to move beyond pilots, and I'm excited that I feel that we really are working right now to work at scale. So a great example that we like to talk about a lot is our work in Kenya that we think is really hitting on all cylinders across this new strategic framework. So if you think of Kenya as a continuum of some very fragile areas in the arid north to much more mature service providers in other parts of the country, we've tailored our programming to be able to be responsive to those different types of contexts. So in the north, we're working on an activity called Kenya Rapid through a much larger integrated platform called the Partnership for Resilience and Economic Growth. And it's just, that is an area of recurrent humanitarian crisis, and actually introducing a development activity there that seeks to work directly in partnership with counties through the devolution process that's going on in Kenya right now has really been transformative, and we're starting to see those investments really pay off. So in the 2017 drought that took place in northern Kenya as compared to earlier droughts in 2011 and earlier in the 2000s, we saw a significantly reduced need for emergency water trucking, which we know is hugely expensive. So really pushing this type of development work in highly fragile areas is one part of the continuum. And then as has been mentioned throughout the morning, we are relying on our interagency partners there as well. So the U.S. Geological Survey, in addition to the work in Ethiopia that Deputy Administrator Glick mentioned, is also working in Kenya to map aquifers up there, really looking at that to improve the efficiency rate of drilling, as was mentioned earlier on the panel. So some really exciting examples there. But as I mentioned, Kenya is geographically diverse, and there's some really exciting opportunities going on in other parts of the country with this devolution agenda, where the national government is delegating the responsibility for water service provision to the county level. So we have two larger activities there. One is our Kenya Integrated Wash activity that is working directly with counties on utility reform and performance to enhance their ability to manage their own service delivery over the longer term. And to date, that's reached over 600,000 people. We're very, very proud of that. And then you'll hear a little bit more from my colleague, Sam Houston, from our WashFin Water Sanitation Hygiene Financing Program later on in the day, because there are robust financial markets in Kenya as well, and there is the ability, as Administrator Wheeler was talking about before, to really leverage domestic private capital and use our foreign assistance strategically to unlock longer-term sources of domestic capital to fund the water and sanitation sector longer term. So that's one example that we really like to showcase a lot. I think it shows the full range of contexts that we're working in, and the power of our interagency partners. And with CDC there as well, on the sanitation side, I would be remiss if I did not mention sanitation. We are leveraging our complementary skill sets. So CDC has invested a lot of market research into a Kenya limited liability corporation called Sanitation that is seeking to transfer human waste into fuel. And they've done a lot of formative research on how to make that viable. And then through our USAID work, we have issued a grant to develop a larger fecal sludge treatment plant, and our WashFin contract has been providing technical assistance on longer-term business planning for their overall financial sustainability. So I think that's also a really nice example of the interagency using our respective skill sets to make a larger difference. Two other super quick examples that I thought just would be nice to talk about, just to showcase the full range of activities that we're involved in. The Water for the World Act, in addition to interagency collaboration, really calls for the agency to more deliberately leverage and coordinate with our other donor partners as well. So this is something that we haven't talked about as much today. But in Nigeria, there's some very promising work. It's early stage right now, but just to kind of paint the picture, Nigeria is one of the only countries that we've seen since the global baseline on access to water and sanitation where access rates have actually declined. Access to piped water in urban areas have declined from 32% in 1990 to just 7% now, which is, that's just a shocking figure. So we, in response to that, have awarded this past year a large $60 million technical assistance package that will be working with state water boards on utility reform and turnaround. I think what's cool and important to highlight about this is that we didn't just go and select 6 state water boards. We actually put out a tender seeking to with key criteria for selection of these state water boards, chief among those being their own commitment to co-invest in the process and their political commitment to utility turnaround. And that is all taking place within the context of our multilateral partners coming in with very, very large infrastructure investments. So our technical assistance on utility reform stands to leverage millions and millions of dollars in multilateral assistance. So I think this is just another really nice example of what we're doing under the strategy with our donor partners as well. And then just on that piece of infrastructure, or in relation to infrastructure, our collaboration with MCC, I think that there's a lot of strong potential there. It was mentioned earlier on the panel that there is a very strict 5-year timeline on a lot of these compacts. We face that too in a lot of our programming, but excited to note that in the wake of this large compact with Lusaka Water and Sanitation, which has invested heavily in water and sanitation infrastructure and drainage systems that will benefit millions of people in Lusaka, our mission is currently looking at longer-term technical assistance to make sure that the government has the capacity to manage and finance and maintain that infrastructure longer term. So those are just 3 examples. I mentioned there's 40-plus missions that we're working in, so certainly just kind of wanted to give a little snippet. But just to kind of wrap it up, with a concluding statement, how we are looking at this longer term is that in alignment with the strategic framework that we've put out in the global water strategy, we know that there are significant portions of the world where access to water and sanitation services lag, so principally in sub-Saharan Africa and in Asia. We know that that's compounded by water stress, and then that can have significant drags on economies. But to get to higher levels of service is hugely expensive and requires host country ownership to really facilitate that journey to self-reliance. So we are similarly committed, as was mentioned by MCC, to private sector engagement, institutional reform and governance, and in financing too, and really just a commitment to learning from all of our programming. So there's a strong feedback loop in making sure that we can improve our programming moving forward.
Thank you, Jeff.
Yeah.
Appreciate it. Well, I appreciate all the panelists. I have we have some time for some questions. I want to make sure that I have questions as well. I will not, because I counted them. There are 32 of them. So I'm not going to ask any questions. I want to come right to the audience and see. We have microphones, I think, on both sides. So if you have a question or two, let's do that now. We've got about 10 minutes or so. To my right here, there are 2 questions here. Yes, please.
Thank you very much.
Because you would have had to go through my full 30-something, and that wouldn't have been.
I would like to hear them,
No, you
actually. So my name is Linda Lilienfeld, and the question is this. As you all have stated, water knits it all together. At the same time, every detail is also very important. In the news today, there are 2 items within a 5-minute newscast about the Midwest and the flooding and the typhoon, the scale of the wind of the typhoon in Africa. When will the water sector act in a way that scales up the activity with each of you that is so detailed and so exquisite and so accurate and right on in terms of working with counties, working with water boards, using your intelligence, when will there be a way to scale up the activity to meet the reality of what's happening around us, costing billions of dollars and affecting people all over? And I wonder if the role of science is important, getting the science out to more people, or if there's a way to build a bridge to the tech firms that have so much money and that are equally concerned in functioning well in a functional world, that we scale up the way we get our funding to maximize the intelligence with which each of you and everyone in this room is contributing to the success in the slow way we get there between sustainable development goals in the international community to the global water strategy here. It's brilliant. It needs to be scaled up rapidly.
Thank you.
Thank you.
Tim, can I impose upon you to take that first?
Yeah, sure. I'll take, and I greatly appreciate the question. My first response is, how better do we equip the people on the ground? Wherever those are at, we can think in theory a long way away. And the Midwest, right? The flooding that's going on there. And at the same time, I'm dealing with drought in other regions that are not that far away on a map, but yet it's a lifetime for people and where they're at. And I think a big part of what both Bureau of Reclamation and U.S. Geological Survey are really doing is trying to provide the science and technology, the forecasting, that modeling to really start to equip the experts on the ground on how then do they then actually, because they're there, to really resource the people that are in those different situations, whether it's drought, whether it's flooding, and or whether they're in the middle of an in-between. How can they manage those water and those resources that they're equipped with?
Let me pose upon Jonathan as well, just maybe some brief comments, and then we'll move to a second question.
Sure. And maybe just briefly building on that. I mean, for MCC, our model really dictates where we work and what we do, but where we are intervening in a sector, even if it's not the water sector, we do take steps to make sure that we draw from the experience and knowledge, in the U.S. and other agencies to integrate, climate resilient infrastructure, looking at capacity on the ground to deal with some of these things. Knowledge sharing is a big thing, and also, learning from our experiences and sharing what worked and what didn't.
Okay, thank you. I know we had a second question right here as well. Please.
Good morning, John Oldfield with Global Water 2020. At the Wilson Center, I feel obliged to ask a difficult question, Mike. So,
please,
to your panel, DOD is not here, the National Security Council, the White House isn't here, the intelligence community isn't here. So I'd welcome your ideas about what's the angle. How do we get? We heard from Administrator Wheeler this morning saying that the president thinks this is very important and ought to be elevated, prioritized, and so on. How do we get the NSC interested? Is there a global health security agenda angle? Is there a Boko Haram weaponizing water angle? I'm just throwing things out here. Mm-hmm. Secondly, to Serena mentioned cholera. So question to CDC and USAID, what more could you guys do from an interagency perspective to not just sort of react and respond to cholera or other wash-related infectious diseases, but actually figure out where they might happen, figure out where they probably will happen, and get ahead of it? Thank you very much.
Thanks, John. Serena?
Sure. So maybe on the cholera question first. I mean, I think, we've had conversations with the World Health Organization about making sure we're utilizing the oral cholera vaccine, when we do have outbreaks. But I think that in many ways is the Band-Aid, right? There's an underlying issue that's contributing to the cholera outbreaks. And if we ignore kind of what we need to do in the wash area, we're just going to keep having the cholera outbreaks come back. So I think, there is agreement that we need to address the underlying issue. I think how to use data in a more effective fashion is something that the agency is also very interested in. The previous questioner talked about, tech companies. I mean, this concept of big data. There's so much data out there. Is there a way to use it, analyze it so that you could be more predictive and get ahead of a cholera outbreak before it really turns into an outbreak? I think that's something that our agency is very interested in. The CDC director has, made it one of his priorities for his tenure to really think about big data and better ways that the CDC can use all of the different surveillance systems that we have, which like a good federal government agency often has very specific surveillance systems tied to a funding line, but how can we make sure that that data is shared and gives you a better picture?
Yeah, so on the NSC question, I think that the political prioritization, irrespective of whether it's here in the US or any of our high priority countries, or any country for that matter, I find that, having worked in the water sector for a while now, our propensity is to talk very technically. We love to kind of get in the weeds and talk about the technical nuance, but I think that for this to be elevated and prioritized in the way that it needs to be, we really do need to work on some of that messaging. So whether that is the global health security agenda, I think that quote on rather work on it in West Africa than in Dallas, those types of compelling messages. My mind instantly went to the World Bank's High and Dry report that came out last year that noted, we referenced to this in the global water strategy, that economies could see their GDP shrink anywhere from 6 to up to 15% as a result of water stress, thereby increasing state fragility and conflict. And it's those types of messages that are a level up from the technical messaging that I think we need to do better as a community about putting out there. And on the cholera question, I'm just certainly echoing that. I think we have some really strong instances of great collaboration. My colleague Rick Gelting is in the audience, and he and I and my colleague Liz Jordan from the Water Office collaborated quite a lot with CDC, building off of their work on the supplemental appropriation that they received after the Haiti earthquake to transition to longer-term programming by USAID. That's one example, but I think that there are a lot of lessons that we could build on from that as we look at other countries and other programming where cholera is present.
Thank you, Jeff. John, I'd just say that I think that one's worth following up on a little bit further, so I'll look forward to talking to you a little bit, maybe offline as well. Let's take one more question from that side of the auditorium. Thank you.
Hi, thank you all so much for being here. My name is Katie Lackey with the U.S. Water Alliance. And Administrator Wheeler mentioned that the water issues we're facing today, many people attribute to climate change, but the roots of those issues actually go way deeper and have been around for a long time. I agree with that, but I also know and have seen that climate change creates a whole different ballgame. It drives up the costs of the water issues that we're facing, the risks, and it brings an incredible sense of urgency to our infrastructure and the water challenges you all are working on. Can you speak a little about how you see climate change factoring into the U.S. global water strategy and/or your work for any of the speakers?
I'll leave it to the first.
I can take that. So we have been talking a lot about, we know that shocks and stresses that are faced throughout many of the countries that we're working in are all water related. So droughts, floods, it was laid out in the introductory remarks on either having too little or too much water. And we know that is becoming increasingly acute. The current trajectory in the agency is to look at this through a resilience lens and how we build the resilience capabilities of households, communities, and systems within countries to withstand shocks and stresses. So this is something that we are very, very much working on. And as far as kind of climate data too, this is integrated into a lot of our programming. So in the Philippines, for example, our Be Secure program is working directly with the water utilities on efficient use of water services through use of climate data. So there are lots of examples of where we are using climate data to improve service delivery, but then also looking at how we can use the aperture of resilience to look at shocks and stresses, many of which are water related through droughts and floods. So it's definitely at the forefront of our thinking as we're designing and implementing programs.
Other comments?
I was just going to add, I mean, I think at CDC, there's a lot of work that does look at the relationship between climate and health. And clearly, it's not just water issues. You can look at vector-borne issues, food security issues. So I think there's a lot of work that goes on to better understand that dynamic and hopefully use that to better inform programming.
Maybe just a few things briefly. I mean, for MCC, we do systematically screen all of our programs for impacts related to climate change, both in terms of how our programs might affect climate change and how climate change might affect our program. So with respect to infrastructure, we want to make sure it's resilient. We have a good example from Philippines where we integrated climate change considerations into the funding of a coastal road that was later hit by a typhoon, Typhoon Haiyan. It actually survived because we had integrated larger drainage systems and strengthened structures that then became a conduit for aid supplies post-typhoon. So we try to do that systematically in our infrastructure, but we also, where it's appropriate, we'll look at ways to build capacity into, the governments, the institutions that are managing infrastructure or carrying out the programs, whether that's providing support for data gathering, monitoring water resources, water levels, or other, other climate-related data as it relates to what that organization's goal is.
And I'll just make one final comment on that. The importance of, at least within the United States governments, to be working together with the state and local governments. All of these areas that deal with climate, you have some agencies that are focused on trying to deal with flooding, so they're trying to move water out of the system, and you have an agency or a bureau like reclamation, which is you want to hold as much because you're trying to offset drought. And so working together becomes critical on balancing all of these aspects of infrastructure, on climate variability. It's all going to be part of that constantly. You're interacting, and then you have to take it to that local level. That's why over 99% of reclamation staff are actually across the whole western United States, in those 17, 18 states are critical for those interactions.
Thank you. Well, the sign of a wonderful panel is that you want more. And I know I want more, hence my 30-something questions that I'll be sending them in an email. I will not do that. But what a fantastic first panel for the morning. We have a second panel coming up. But would you please thank Tim, Jonathan, Serena, and Jeff for an outstanding discussion.
Thanks, Mike.
Thank you so much.
Yeah, thank you.